Good day, grade 10. Today is our MAPEH 10 from 4th quarter, week 2. Again, my name is Rinaldo B. Malimban. In our topic, we talk about the health risk issue concern in the global health issues. Now, what is global health issues? A global health is the health of population in a global context. It refers to the area of study, research, and the practice that place the priority of improving health in achieving equity and health for all people worldwide. So we define global health as an area for study, research, and practice that place priority improving health and achieving health equity for all people worldwide. So the global health is focused on people across the whole planet rather than the concern of particular nations. So problems that transcend national borders or have global, political, and economic impact are often emphasized. Global health is about worldwide health, improvement, reductions of disparities, and protections against global threats that disregards national borders. So this global health is not to be confused with international health, which is defined as the branch of public health, focusing on developing nations and foreign aid efforts by industrialized countries. Now, we have the 13 biggest health challenges for the next decade in 2021. Climate crisis, healthcare delivery areas of conflict and crisis, healthcare equity, access to treatment, infectious disease prevention, epidemic preparedness, unsafe products, and the under-investment in health workers. The predominant agencies associated with the global health and international health is the World Health Organizations or WHO. The second is UNICEF. The third is the World Food Program, and the fourth is the World Bank. So the United Nations has also played a part with the declarations of Millennium Development Goals. So this international health employs several perspectives, the focus of determinants and distributes of health and international context. So these are the medicine describes the pathology of disease and promotes prevention, diagnosis, and treatment. Public health emphasizes the health of populations, and epidemiology help identify risk factors that cause of health problems. Demography provides data for policy decisions. Economic emphasizes that cost of effectiveness and cost-benefit approaches for the optimal allocations of health resources. And other social sciences such as sociology, development studies, anthropology, cultural studies, and law can help understand the determinants of health in societies. So both individuals and organizations working in the domain of global health often face many questions regarding the ethical and human rights solutions. Now let's talk about the 10 global issues to watch. These are the top global health issues that will affect in some way the 7 billion people in the world. One is the people-centered system. Each part of health system requires people to make healthcare work, not just clinicians, but statisticians, finance experts, technologies, and all people who are seek healthcare services. The second is new sustainable development goals. So the new goals unite countries on path toward one of international community most of ambitious goals. Universal health coverage to achieve it will need a greater focus as global health workforce that the world has been seen, especially no poverty, zero hunger, good health and well-being, quality education, gender equality, clean water and sanitations, and all function of new sustainable development goals. Another is the Ebola. Ebola killed over 8,000 people in 2014, and 2015 West American world will continue struggling to continue the epidemic. Ebola has made clear the global need to invest in health system for a long term and health workers. So the Ebola what is? The highly deadly hermaphroditic fever virus resulting in systematic viral infections throughout the body. And we believe that fruit bats is inhabiting West African forest that natural host for the virus. So this virus first attack white blood cells, then infiltrates nearly every type of cell in the body. Next is the war and unrest. Physicians for Human Rights says more than 500 health workers has been killed in ongoing conflict in Syria, Ukraine, Gaza, Syria, South Sudan, Africa, and Nigeria, where civil unrest and acts of terrorism can hinder or even reverse progress all aspects of global development, including health, education, and gender equality. In 2014, the United Nations stepped up to lead the global effort to protect health workers and hold accountable those who are perpetrate violence against them. Next is the global health security and surveillance. The reduces of vaccine, preventable illnesses like mumps, measles, and polio, and dangerous outbreak of Ebola in West Africa are threats to global health security project that it will be take international cooperation to create better disease and surveillance system, establish law and policies that bolster health system and prevent violent conflicts. That is to ultimately make a healthier and safer world. Let's move on for another slide about the mobile tech. In 2014, Liberia began using technology called MAPEH that allows the Ministry of Health to send critical information to health workers' mobile phones on the same way. In health works can use is to send time sensitive information to ministry officials and to one another. So in the hand of trained connected health workers, mobile technology has the power to transform healthcare. It can help lone health workers in even the most remote isolated village get up-to-date training and provide high-quality care. It can help patient avoid quacks, and health worker can get information that can save lives. Next is the family planning. According to Dr. Jacob Steen, Senior Medical Advisor at IntraHealth, there was an increase in number of women and girls using modern methods of contraception by 8.4 million or 8 2020 in global partnership to make family planning more available reported amazing global results. In 77 million unintended pregnancies averted in 125,000 women's and girls' lives saved. The Senegal's impressive progress on the new method of distribution called the Emport-a-Post model completely eliminated contraceptive stock sense and public health facilities and became Senegal in just 6 months. Next is AIDS. AIDS an end in sight or prevention. In 2014, UNAIDS announced a new fast-track strategy to end the AIDS epidemic by 2030, according to UN officials. If the world does not rapidly scale up in the next 5 years, the epidemic is likely to spring back with high rate of new HIV infection than today. Next is the cancer. This is the results from the largest cancer study ever published, released last month by Lancet, show the cancer kills for people in low middle income countries than HIV, malaria, and tuberculosis combined. Cancer in other non-communicable disease will not get all attraction and resources they deserve in 2005. because Ebola will likely stunt global progress in addressing them these years. And the last is the mental health. According to officials of the World Health Organization or WHO, and well-being are fundamental to our collective and individual ability as humans to think, emote, interact with each other, earn a living, and enjoy life. However, depression, post-traumatic stress disorder, dementia, substance abuse, and other mental health challenges affect the high and the low-income countries alike. So the Ethiopia is just a country that began focusing on a mental health service in 2014 when trained health workers provide mental health care within prison for the first time. As the civil unrest, economic stability, and traumatizing Ebola outbreaks of 2014 continue into the 2015, mental health needs will only become more urgent, and so will be need for more trained social services, psychiatrists, and other health workers. Let's move on for the health conditions targeted by global health. So these are some diseases and health conditions targeted by global health initiatives may be grouped under the disease of poverty and disease of affluence. And also the health diseases and conditional include respiratory infections, diarrhea disease, maternal health care, HIV or AIDS, malaria, nutrition, violence against women, chronic disease, health intervention. In the first part of the health conditions targeted by global health is the respiratory infection. Of global significance include tuberculosis, measles, influenza, and pneumonia caused by pneumococci and Hypothecus influenza. The spread of respiratory infection is exacerbated by grounded conditions and poverty associated with more than 20-fold increase the relative burden of lungs infections. So these are the types of upper respiratory infections that include common cold or head cold. So the lung infection may be also lead the stuffy or the runny nose, sore throat, sneezing, itchy muscles, and headache. Next is diarrhea disease. Diarrhea is the second most common cause of child mortality worldwide and is responsible for 17% of death of children under age 5. So this diarrhea is usually symptoms of bowel infections, which can be caused by the virus. Poor sanitation can increase transmission of bacteria and viruses through the water, food, utensil, hands, flies. Oral rations are therapy of effective treatment for dehydrations. Important nutritional measure includes the promotions of breastfeeding and zinc supplementations. A vaccine can be administered to prevent the rotavirus diarrhea. Next is the maternal health. According to the WHO's in 2005 World Health Report, poor material conditions are leading causes of death for women worldwide. In many developing countries, complications of pregnancy and childbirth are leading cause of death among the women of reproductive age, which is the approximately 1 every minute. So maternal health refers to the health of women during the pregnancy, childbirth, and the postnatal period. So this target of improving maternal health include and increasing the number of deliveries accompanied by the skilled birth attendants. Next is the HIV or AIDS, human immunodeficiency virus. Is transmitted through the unprotected sex or unprotected sex, sexual intercourse, unclean needles, and blood transfusions, and from mother to child during the birth of lactations. So the infections of damages the immune system leading to acquired immunodeficiency syndrome are eventually death. Antiretroviral drugs prolong life is delay the onset of AIDS by minimizing the amount of HIV in the body. Next is the malaria. Malaria is a mosquito-borne infection disease caused by parasites of genus Plasmodium. Each year, there are approximately 500 million cases of malaria worldwide, most commonly among the children and pregnant women in developing countries. This malaria is disease caused by parasite. The parasites is spread to human through the bites of infected mosquitoes. People who have malaria usually feel very sick with a high fever and shaking chill. So this the use of insecticide-treated bed nets has been used to reduce malaria infection. Next is nutrition. Nutrition is the study of nutrients in food, how the body uses them, and the relationship between diet, health, and disease. Nutritionists use ideas from molecular biology or biochemistry and genetics to understand how nutrients affects in the human body. Underweight and undernutrition contributes to about the third of child death around the world. Malnutrition refers to the poor proportions of food intake, and this refers to the obesity. Undernutrition impairs the immune system. Deficiencies of micronutrients such as vitamin A, iron, iodine, and zinc are common worldwide and can affect intellectual potential, growth, development, and adult productivity. Interventions to prevent malnutrition include the micronutrient supplement, fortifications of basic growing food, dietary diversifications, hygienic measures to reduce spread of infections, and promoting of breastfeeding. Next is the violence against women. These forms of violence can be led by depression, post-traumatic stress, and other anxiety disorders, sleep difficulties, eating disorders, and suicide. The violence against women define physical, sexual, and psychological violence occurring in the family and general community, including the battering, sexual abuse of children, dowry-related violence, rape, female genital mutilations, and other traditional practices harmful to women. Other forms of violence of women may include the exploitations, sexual harassment, and intimidations at work, trafficking in women, forced prostitution. Next is the chronic disease and non-communicable disease. Approximately 80% of death linked to non-communicable disease occurs in developing countries. And low-income countries, the number of individuals with diabetes is expected to increase from 84 million to 228 million by 2030, and 60% of global burden of disease has been accounted by obesity. According to chronic diseases are defined broadly and conditions that last year or more, require ongoing medical attentions or limit activities of daily living of both. Chronic diseases as heart disease, cancer, diabetes are leading causes of death. And also a non-communicable disease or NCD is a disease that is not transmissible directly from one person to another. Next is the last, the health intervention. The global intervention for improved child health and survival include the promotion of breastfeeding, zinc supplementation, vitamin A fortifications, salt iodizations, hygiene, interventions such as hand washing, vaccinations, and treatment of severe acute malnutrition. So many population face an outcome gap, which refers to the gap between members of populations who have access to medical treatment versus those who do not have. Countries facing outcome gaps like sustainable or the what you call in other treatment. In the World Health Report of 2016, the World Health Organization estimated certain age of almost 4.3 million doctors, midwives, nurses, and support workers worldwide, especially in sub-Saharan Africa. So this health intervention is an act of performed for, with or behalf or person population. Those are purpose into assist, improve, maintain, promote, or modify health functioning or health conditions. And today, thoughts for today, always laugh when you can. It is cheap medicine. That's all for today. In your module, please answer the following activity. For more updates, please monitor your e-class online learning platform. My name is Rinaldo B. Malimban. Thank you and goodbye.